Thank you very much. Very exciting time for me and also for the field of pediatric neuro-oncology with this first ever randomized clinical trial of targeted treatment versus standard of care chemotherapy in patients with low-grade glioma. The focus is a subgroup of patients with a specific mutation of BRAF V600E. For this, I need perhaps to give you a bit of background on glioma in the pediatric population. This is by far the most common pediatric brain tumor, and it's divided in low-grade glioma, grade 1 and 2, and high-grade glioma, grade 3 and 4. Low-grade glioma accounts for around 90% of the glioma, with a number which is above 1,000 patients in the US per year. Treatment of pediatric low-grade glioma is with surgery primarily, but there are situations or places in the brain where surgery is not possible. And in this context, the first-line treatment is chemotherapy. There are various factors that affect the efficacy of chemotherapy, and in particular, the molecular profile of the tumor. Among the molecular markers that have been identified, the presence of a BRAF V600 mutation is associated with a poorer response to chemotherapy and a risk of transformation. We see this mutation in 15 to 20% of the patient. Therefore, a need to develop new treatment. There was initially a study of Dabrafenib that was conducted a few years ago that has demonstrated tolerability and efficacy in this context. And due to the data in the adult population, particularly in melanoma with the same mutation, BRAF V600 mutation, the addition of trametinib was showing an improved response rate and decreased side effect. Therefore, a logical next step was to add trametinib to Dabrafenib for subsequent clinical trial in children. This started in 2014 with a phase 1 and then a phase 2 study. And this study have shown promising results and a good safety profile. The logical next step was to compare with the standard of care, and that's what I'm going to present now. The eligibility criteria were children aged 1 to 18 years of age with a BRAF V600E mutation in their tumor, with the presence of residual tumor, and without previous overtreatment and surgery. Indication for treatment were the classical indication, progression after an incomplete resection, or the need to start immediate treatment due to the risk of neurological complication. The bottom of the slide relates to the presentation that was done by Darren Hargrave yesterday. So I'm focusing on the higher end of the slide. The randomization was a 2-to-1 randomization of the experimental treatment, Dabrafenib and trametinib, given as long as there was evidence of clinical benefit versus chemotherapy that was given over a fixed period of time of 14 months. There was a possibility to cross over for patients who progress on chemotherapy or after chemotherapy. 58 sites contributed to the study, and this slide summarizes the results. A striking and significant difference in the overall response rate, which was reported by an independent assessment using strict RANO criteria, 47% versus 11% in the chemotherapy arm. Also, a very significant difference in progression-free survival, with 66.6% progression-free survival with the experimental arm at 1 year versus 26.1% in the chemotherapy arm. A longer progression-free survival in the experimental arm of 20 months versus 7.4 months. Looking at the safety of the combination and the safety of this experimental treatment, in fact, all patients presented at least one adverse event. But looking at the grade 3 and more adverse event, there was apparently a difference which was in favor of the experimental combination, with 47% grade 3 and over, side effect versus 94% in the chemotherapy arm. The specific side effects were classical, with essentially hematological toxicity and GI toxicity in the chemotherapy arm, and pyrexia and skin toxicity in the experimental arm. So in conclusion of this short summary, there are exciting data because they suggest that there is a possibility to offer a new treatment upfront for these children with low-grade glioma associated with this BRAF V600 mutation. This study showed a higher overall survival, higher overall response rate, a higher clinical benefit rate, a longer median progression-free survival with the experimental treatment, a good safety profile with manageable side effects, and importantly, we were able to use a liquid formulation, and this is important because no child was left behind. Also, the toddler were able to take the medication, and we were able to do very fine-tuning and weight-adjust treatment for this population. But very important, this is not a treatment for all patients with low-grade glioma. This is specific to a population. And this study demonstrates how important it is to document as early as possible the molecular alterations that are present in this type of tumor. Thank you very much.